Autonomic neuropathy. Autonomic neuropathy is damage to nerves that control your internal organs. Autonomic neuropathy can lead to problems with eyes, bladder, sex organs, sweat glands, digestive system, heart rate and blood pressure. Ability to sense hypoglycemia, a condition called hypoglycemia unawareness. Causes of autonomic neuropathy. Over time, high blood sugar and high amounts of fats, such as triglycerides, in the blood are caused by diabetes. They can damage your nerves and the small blood vessels that nourish your nerves, leading to autonomic neuropathy. Symptoms of autonomic neuropathy. The symptoms of autonomic neuropathy depend on which of your body's functions are affected. Heart rate and blood pressure. Damage to the nerves that control your heart rate and blood pressure. It can cause these nerves to respond more slowly to changes in body position, stress, physical activity, sleep, and breathing. So, you may feel lightheaded or faint when you stand up from lying down or sitting, or when you do a physical activity. What's more, you may feel your heart rate fast, increase or slow down suddenly. Nerve damage can also prevent you from feeling chest pain when your heart doesn't get enough oxygen or when you have a heart attack. Digestive system. Damage to the nerves of your digestive system can cause symptoms such as the following: vomiting and nausea, bloating, fullness, fecal incontinence, problem swallowing, constipation, diarrhea, especially at night, diarrhea alternating with constipation. Moreover, autonomic neuropathy may also cause gastroparesis. Gastroparesis is a disorder that slows or stops the movement of food from your stomach to your small intestine. On the other hand, gastroparesis can keep your body from absorbing glucose and using insulin properly. So, these problems can make it hard to manage your blood glucose. Bladder. Damage to the nerves of your bladder may make it hard to know when you need to urinate and when your bladder is empty. So, this damage can cause you to hold urine for too long, which can lead to bladder infections. You may also leak drops of urine. Leaking urine or not being able to hold urine is called urinary incontinence. Sex organs. In men, damage to nerves in the sex organs may prevent the penis from getting firm when a man wants to have sex. This condition is called erectile dysfunction, also called ED. Men also may have problems with ejaculation. In women, damage to the nerves in the sex organs can prevent the vagina from getting wet when a woman wants to have sex. A woman might also have less feeling around her vagina and may have trouble having an orgasm. Sweat glands. Damage to the nerves that control your sweat glands may cause you to sweat a lot at night or while eating. Your sweat glands may not work at all, or certain parts of your body may sweat while other parts are dry. When your sweat glands do not work properly, your body may not be able to control its temperature. Eyes. Damage to the nerves in your pupils may make them slow to respond to changes in light and darkness. Your eyes may take longer to adjust when you enter a dark room. You may have trouble seeing the lights of other cars when driving at night. Ability to feel symptoms of hypoglycemia. Autonomic neuropathy can cause hypoglycemia unawareness, meaning that you don't feel the symptoms of low blood glucose. Normally, early symptoms of low blood glucose can include feeling confused, dizzy, hungry, irritable, or nervous. When nerve damage keeps you from feeling these symptoms. To greater than you may not take steps to treat your low blood glucose. Without treatment, you may develop severe hypoglycemia, which can cause you to pass out. Therefore, you will need help right away to deal with severe hypoglycemia. Diagnosis of autonomic neuropathy. Doctors diagnose autonomic neuropathy based on your symptoms, family and medical history, a physical exam and tests. Also, your doctor will check your heart rate and blood pressure and may perform additional tests to check for different types of autonomic nerve damage. Diagnostic tests. To diagnose autonomic neuropathy, your doctor may use a few tests. To greater than to assess changes in your heart rate in response to simple movements such as deep breathing or standing. Your doctor may also use tests to check your sweat function to know how your nerves and sweat glands are working. Depending on your symptoms, your doctor may also use blood pressure checks while you are lying down and then after you stand up. Gastric emptying scintigraphy and gastric emptying breath tests to diagnose gastroparesis. Ultrasounds of your bladder and urinary tract to check how your bladder is working. Tests to rule out other causes of digestive symptoms, such as constipation and diarrhea. How to treat autonomic neuropathy. You can help treat autonomic neuropathy by managing your diabetes. This means managing blood sugar, blood pressure and cholesterol. So, staying close to your goal numbers can keep nerve damage from getting worse. Your doctor may treat the symptoms caused by autonomic nerve damage. Heart rate and blood pressure. Specifically, your doctor will treat the symptoms of nerve damage that affect your heart rate and blood pressure. Your doctor may recommend avoiding hypoglycemia, getting more physical activity, increasing the amount of liquids you drink, increasing salt in your diet if your blood pressure drops too low when you stand up, raising the head of your bed or wearing elastic stockings to improve blood flow, sitting or standing slowly to prevent lightheadedness or fainting. In addition, your doctor may also prescribe medicines that help your body retain salt, medicines to help raise your blood pressure, or medicines that raise or lower your heart rate. Digestive system. Your doctor may recommend changes to your diet and over-the-counter, or prescription medicines to treat digestive symptoms and problems such as constipation, diarrhea, fecal incontinence, gastroesophageal reflux, gastroparesis. In particular, talk with your doctor before taking any over-the-counter medicines to treat problems with digestion. On the other hand, your doctor may refer you to a gastroenterologist for treatment. Bladder. Your doctor will treat your bladder problems by focusing on your symptoms. When you have incontinence, your doctor may recommend planning regular trips to the bathroom, because you may not be able to tell when your bladder is full. Your doctor may also prescribe medicines to help with incontinence or help if you have problems completely emptying your bladder. If you have a bladder infection, your doctor may prescribe an antibiotic. At the same time, your doctor will recommend drinking plenty of fluids to help prevent future infections. Sex organs. Doctors may recommend medicines or devices to treat erectile dysfunction. Of course, doctors may refer men to a urologist to treat sexual problems. Also, to treat sexual problems in women, doctors may refer women to a gynecologist. Doctors may recommend vaginal lubricants when neuropathy causes vaginal dryness. Sweat glands. When you have too much sweating, your doctor may suggest avoiding too much heat or humidity, a prescription antiperspirant or medicine to decrease sweating, surgery to cut the nerves in the sweat glands or to remove sweat glands. Hypoglycemia unawareness. When diabetes-related nerve damage leads to hypoglycemia unawareness, you may need to check your blood glucose more often, so you know when you need to treat hypoglycemia or take steps to prevent it. Your doctor may prescribe a continuous glucose monitor, CGM. A CGM checks your blood glucose levels at regular times throughout the day and night. CGMs can tell you if your blood glucose is falling quickly and sound an alarm if your blood glucose falls too low. When you pass out due to severe hypoglycemia, someone will need to give you a glucagon injection and call 911. An injection of glucagon will quickly raise your blood glucose back to normal. Ask your doctor about when and how to use a glucagon emergency kit. Consider wearing a Diabetes Medical Alert ID bracelet or pendant. If you pass out, this Medical Alert ID will tell other people that you have diabetes and need care right away. Note: diabetes is a dangerous disease with many complications related to the kidneys, heart, liver, and causes many serious health effects. Understand the causes and prevention of the disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action and start enjoying the benefits. Reference: Diabetes Freedom, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falundafa.org. Thank you, I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.